In different school-related news here, North Carolina stepping in with extra mental health resources for students. This as mental and behavioral health struggles continue to create challenges in schools. And as we've mentioned before, this problem has only worsened during the pandemic. WCNC Charlotte's Chloe Leshner joining us live from CMS headquarters to talk about these new measures that are going into place. So, Chloe, what is the state doing here?
Hey, Vanessa, the state's now working with 130 public schools to essentially bring in a team of child psych experts to better support teachers and students. CMS schools are on that list, and it's something that districts across the state have been asking for. There's an urgent and growing need for mental and behavioral health support among children and teens.
In North Carolina, for example, we've seen almost a 50% increase in the number of children who are really struggling with major, significant depression.
Dr. Charlene Wong, Assistant Secretary for Children and Families with the North Carolina Department of Health and Human Services, says half to 3/4 of those kids are not getting the help they need, and it's showing in schools.
What we heard from them is that from several schools was that because students were struggling so much with behavioral health challenges in school, it was really taking a lot of time from school leadership, teachers, staff.
The state now expanding access to mental health resources. CMS, Cabarrus County Schools, and Kannapolis City Schools are among the 10 districts in our area benefiting. Experts with the North Carolina Psychiatry Access Line will provide education and training for school staff to better help students who are struggling.
For example, there might be an elementary school that's noticing that they have a lot of younger children who are seeming to have some anxiety that's making it hard for them to pay attention in class. So NCPAL would bring their child psychiatry experts to the table with the school leadership and help advise on what could they do to help those young students.
State officials say they have the funding to do this in the 130 schools for this school year, but they are always looking for more funding so that they can continue and expand the program. Now, 22 CMS schools will have access to these resources, and I'm told by CMS officials that more schools were interested. Live at CMS headquarters, Chloe Leshner, WCNC Charlotte.